My name is Dr. Rashmi Patel, and I am a psychiatrist and medical researcher at King's College London. I would like to tell you about our research study investigating whether there is an association between antidepressant medications and risk of developing mania. I've had a letter from your GP and he's explained that you've been feeling a bit low for a few weeks and that he started an antidepressant to try and help with your mood, but that you've since had some side effects from this. Is that right? Yeah. Antidepressants are a safe and effective treatment for depression. However, in a minority of cases, people who take antidepressants can also develop symptoms of elevated mood and mania as part of a bipolar disorder. This is important because although bipolar disorder is uncommon, people who are affected often first present with symptoms of depression, and if left untreated, bipolar disorder can be very distressing and significantly affect social and occupational functioning. Is this the first time you've taken an antidepressant? It is. In our study, we investigated the association of antidepressants with mania in people with depression receiving care from the South London and Maudsley NHS Foundation Trust, a large provider of specialist mental health care. We analysed data from anonymised electronic health records using state-of-the-art data extraction software called the Clinical Record Interactive Search Tool, otherwise known as CRIS. Using CRIS, we were able to obtain data from over 21,000 people with depression. Our research is particularly important as there are few studies which have investigated this question using large volumes of clinical data obtained from a real-world healthcare setting in the UK. We found that antidepressants were widely prescribed and associated with a small increased risk in developing mania. However, we did not demonstrate a causal association between antidepressants and mania. Instead, it is likely that people who develop symptoms of mania with antidepressants already had a propensity towards developing mania prior to antidepressant treatment. And we obtained data. Our findings highlight the importance of considering the possibility of bipolar disorder in people who receive treatment for depression. And further research is needed to develop better ways of identifying people with depression who may be at risk of developing bipolar disorder. On the other hand, it is important to remember that the overall likelihood of developing bipolar disorder following depression is low, and antidepressants continue to be a safe and effective treatment for depression and anxiety disorders. However, if you are taking antidepressants and are concerned that you might be experiencing adverse effects, it is important to seek medical advice and not to stop your treatment suddenly, as this may result in withdrawal symptoms.
I've noticed that I'm not sleeping as well. I just don't need sleep.
In summary, our research suggests that antidepressants are associated with a small increase in risk of developing mania, and further research is needed to better identify who may be at risk. But the overall risk is low, and antidepressants continue to be a safe and effective treatment for depression.